Yeah, we're in the second wave of COVID right now, and we're in the thick of it in BC, so I am worried that those overdose numbers, the deaths, will shoot back up again. In the summer, we had record overdose deaths. I kind of wouldn't be surprised if we see it again coming up. And I don't think it's a high enough priority on the government's list of things to do. The NDP went through an election campaign and they basically said more of the same. And to me, more of the same means a lot more people dying. In August, we all got up and walked away from the table with the province. A bunch of us in different groups, we sat at these committees to try and work through the solutions to the overdose crisis with the government of BC. But there was no sense of urgency there. Even when there were record overdose deaths in the summer months, we just felt like there wasn't an appetite to really take the bold moves that would solve the thing. Even while we saw bold moves happening for COVID. So we had to walk. We also saw the Premier talking in June, drug use is a choice, drug use is not rational, all these sorts of things. And there's some truth to that, but his quote really showed me that he didn't understand what was going on, and he'd never taken the time to figure it out. So we just left the tables and thought, let's meet with the Premier. Let's get up the food chain a little bit, get to the boss, get to the guy in charge. He just never answered us. He just, we asked if we could meet. Nothing. Radio silence. A few days before the election campaign started, the government announced that nurses could now prescribe medications for addiction. And, that is a good measure, but it's not as easy as you would think. Unlike other public health orders that come into effect that day, this one, nurses prescribing meds, that's going to be next year sometime. So there's no sense of urgency, and it reveals something else, that a lot of doctors don't want to do it. So the government was almost looking for, maybe someone else will do it. So I don't know what kinds of, tripping hazards there are, bureaucratic barriers and everything on the way to a nurse being able to write a prescription. But if history is any indication, I'll bet there's going to be a bunch. In March, we were able to convince the government to expand the kinds of medications that are prescribed for people with substance use disorder. So for years and years, it was kind of methadone, and the drugs have gotten stronger and stronger and stronger. And so we've always said there's got to be more options. And the policy was accepted by the government, but there was no implementation plan. And a lot of the doctors don't really seem to want to do it. So a very small number of drug users in BC are actually able to access this. So right now, with a few exceptions, it's still as hard as it's ever been to find your way onto something safer than the street drug supply. I know that as an activist, part of my job is to be hopeful and inspire other people to be hopeful, but that's not how I feel. And I can't bullshit people. I feel angry and grief-stricken, and frankly, I don't know what the next move is for us. We've been proposing the things that could stop this overdose crisis since the last overdose crisis in the 90s in Vancouver. And it's very hard to punch through. Until we can convince the people in charge to take it seriously, until we can embarrass and arm twist and cajole and motivate them into caring about this, I don't feel hopeful.